Good morning, everybody. My name is Imelda, and today our lesson is about sepsis. The objectives of this session is that students will define sepsis, identify populations who are at risk, describe the signs and symptoms of sepsis, discuss sepsis prevention and treatment, and summarize complications of sepsis. So we are going to start with defining what sepsis is. According to the CDC, sepsis is a body's extreme response to an infection. It causes organs to function poorly and abnormally, and sepsis is a potentially life-threatening condition. And sometimes it leads to death, unfortunately. Annually in the US, 1.7 million adults develop sepsis. 270,000 die due to sepsis. 1 in 3 who die in hospital has sepsis. And it is the most expensive condition, amounting to $24 billion in 2013. So what causes sepsis? Sepsis is caused by bacterial, viral, or fungal infection. Infection can start in the lungs, such as pneumonia. It can start in the kidneys or bladder, such as urinary tract infection. It can also start in the digestive system, in catheter sites such as ports or PICC lines. It can also start from having wounds or burns, and oftentimes it is spread through the bloodstream. So who is at risk for sepsis? Adults who are 65 years and older, children less than 1 year, those people with chronic medical conditions such as diabetes or high blood pressure, chronic kidney diseases, also those people with weakened immune systems such as cancer patients, and those sepsis survivors are at risk. So what are the signs and symptoms of sepsis? One is change in mental status, a systolic blood pressure of less than 100 millimeters mercury, respiratory rate greater than or equal to 22 breaths per minute. It can also be one or combination of confusion, disorientation, shortness of breath, high heart rate, fever or shivering or feeling very cold, extreme pain or discomfort, clammy or sweaty skin. So how do we prevent sepsis? The very first prevention that we can do is to prevent infection, and we can do that by practicing good hygiene, which we can start with good hand washing. Second, we can prevent sepsis by managing chronic conditions. Chronic conditions such as diabetes or chronic kidney diseases. Make sure that you do your annual checkups and follow your medication regimen. Number 3, we can prevent sepsis by getting vaccines such as pneumonia vaccine to prevent pneumonia, help prevent pneumonia, flu vaccines to help prevent the flu, and also now we have the COVID vaccine. Number 4, we can prevent sepsis by knowing the signs and symptoms of sepsis, so that when you or your loved one is sick and you're showing signs and symptoms of sepsis, then you would know what to do. And number 5, you need to act fast. So what do you do when you're suspecting sepsis? The very first thing you can do is talk to your doctor, ask for advice. Now, if you cannot contact your doctor, the next thing that you can do is go to the ER. It's always better to be safe than sorry. So when you are in the ER, what they usually do is do some blood tests and check for sepsis markers. So the best marker for sepsis is measuring serum lactate or lactic acid in the blood. The normal serum lactate is 0.5 to 1 millimole per liter, and patients of sepsis usually have serum lactate greater than 4. Now, some studies indicate that if the serum lactate is 2.5 or greater than 2.5, most likely that person has sepsis or at risk for getting sepsis. Another marker for sepsis is procalcitonin. The normal procalcitonin is 0.5 ng per ml, and a person with sepsis most likely will be having a procalcitonin greater than 2 ng per ml. So what is the treatment for sepsis? The very first thing that providers do is to correct or treat the infection, which is the source of your sepsis, usually by IV medications. And then to correct blood pressure, providers give fluids, and also in the ED they monitor temperature and blood pressure, urine output, and mental status. So what are complications of sepsis? Because of a loss of blood flow due to very low blood pressure, sepsis can lead to organ failure, which can be in the brain, in the kidneys, or the heart and lungs. Sepsis can also progress to septic shock. So septic shock is a dramatic drop in the blood pressure wherein IV fluids is not enough and medication is needed to maintain systolic blood pressure to be greater than 65 millimeters of mercury. If septic shock is not treated, the result will be severe organ damage and eventually death. Most people recover from mild sepsis. The mortality rate for septic shock is 40%, and an episode of severe sepsis puts a person at higher risk of future infections. So I have here a video for the summary of sepsis, and let's watch it.
Sepsis, formerly called blood poisoning, is usually triggered by a local infection, such as pneumonia in the lungs, an infected wound, or infection of the urinary tract. Should bacteria from the local infection spread or secrete toxic substances into the bloodstream, the immune system may sometimes go into overdrive, causing inflammation throughout the entire body. You get sepsis. This interferes with the blood flow, which leads to a drop in blood pressure, making it difficult for the blood to carry oxygen to the body's major organs. This can lead to failure of organs such as the lungs, the kidneys, or the heart. In the worst cases, the patient dies in a matter of hours. Detecting sepsis early is crucial, so be attentive to symptoms such as fever and chills, breathing difficulties, diarrhea and vomiting, confusion and slurred speech, low blood pressure and elevated heart rate, low urine production. Sepsis can affect anyone. Help us stop sepsis.
Okay, so that's a good summary on sepsis. Here's an infographic showing summary for the pathway for sepsis. So first, we get, or the body gets infection, which is caused by a bacteria, a virus, or a fungus. And then what happens is it enters the blood, the bacteria, virus, or the fungus, and enters the blood. And because of that, the body creates an extreme immune response and causing a leaky blood vessel. And because of that, the blood pressure drops. And because of a drop in blood pressure, there will be very less perfusion to the body's organs, and it can lead to organ dysfunction. And if it is not corrected, it can lead to death. And that's the end of our lesson. we are going to do some discussion. I'm going to give you some worksheet, and you can work on it for maybe 5 minutes, and then we'll come back and discuss it. And we're back. So let's go over the worksheet. Now, who can tell me causes of sepsis?
Bacterial, viral, fungal infection.
Okay, hold on, let's put it on there. Bacterial, viral, fungal infection. So, where do we usually see this?
In the lungs,
Okay.
the kidneys,
In the lungs, kidneys,
the bladder,
bladder,
digestive system,
digestive system,
burns, and wounds.
burns, and wounds. Okay, very good. So, who is at risk for sepsis?
Adults greater than 65 years.
Greater than 65.
Children less than 1 year.
Children less than 1 year.
Chronic medical conditions.
People who have chronic medical conditions. Anyone else?
Weakened immune systems,
Okay, people with weakened immune system.
and sepsis survivors.
Sepsis survivors. Okay, so next on our worksheet, what are the signs and symptoms of sepsis?
Change in mental status.
Change in mental status.
Systolic blood pressure less than 100.
Anything else?
Respiratory rate greater than 22.
Okay, what else?
Confusion,
Okay, confusion or change in mental status. What else?
shortness of breath,
Shortness of breath,
clammy, sweaty skin.
clammy, swelly skin. Okay, I think that's enough. What do we do for sepsis prevention?
Practice good hygiene.
Practice. Okay, hold on. We increase the font. What else?
Manage chronic conditions.
Can you give me example of a chronic condition? Like diabetes? What else? Like chronic kidney disease? Okay, so other prevention measures.
Get vaccines,
Get your vaccines. What are examples of this vaccine?
COVID-19, the flu,
Okay, flu vaccine, etc. What else? What can we do to prevent sepsis?
know the signs and symptoms,
Know the signs and symptoms. Okay, and what else?
and act quickly.
Act quickly. Very good. Now we go to treatment. So how do we treat sepsis?
IV medication.
Okay, IV medications to treat the infection.
IV fluids.
Okay, IV fluids for or to increase blood pressure. What else?
Monitor temperature,
Yeah, monitor temperature. What else is monitored?
blood pressure,
Blood pressure,
urine output,
urine output,
and mental status.
mental status. Very good. And lastly, what are the complications of sepsis?
Organ failure.
Okay, organ failure, that's like
The brain.
okay, in the brain. Where else?
Kidneys,
Kidneys,
heart and lungs.
heart, and lungs. Okay, good job, guys. So this ends our lesson for sepsis, and I hope you learned something.